Good afternoon, teammates. Myself and my battle buddy, Command Sergeant Major Clark Charpentier. You may have noticed we are wearing the Class B version of the Army Green Service uniform.
New year, new uniform. Gonna make a change and start out right.
There we go. 36 Town Hall. We got a lot of information to go over this time, so we've made it a little bit more time to chat with you all and to take your questions. We have a number of things to talk about. The first item that I wish to discuss is on a very, very somber note, but I need to share it with you, and you probably already heard, but that was the loss of one of our drill sergeants, Staff Sergeant Jessica Mitchell. And she was found shot to death on Interstate 10 in the early morning hours of New Year's Day. And it came as a surprise and a shock to all of us, and we are deeply disturbed and deeply saddened by the loss of one of our drill sergeants, one of our teammates, and we are sorting through this as an organization right now. What we want is swift justice for Drill Sergeant Mitchell, and that is one of our top priorities here, is to take care of her and take care of her family and take care of our teammates whose lives interacted with Sergeant Mitchell. The San Antonio Police Department is actively investigating this crime. It is backed up by Army CID, and I have full confidence in the San Antonio Police Department, and I know that they are aggressively working this, and we'll just leave it at that. I would ask that you don't speculate on social media as to what may have happened or what didn't happen, because we simply don't know. There are so many things about this case we don't know. But please, let's stick to the facts once they become known, and once we have information that we are authorized to share, we would definitely share with you. Here's what we know is that SAPD is looking for a red car, and that was posted on one of their tweets on Twitter. And there was some transfer of red paint from another car onto Drill Sergeant Mitchell's car. And if you know anything, please give the San Antonio Police Department a call so that you can share that information. Our focus is to remain on paying the final respects, like I just said, to this great non-commissioned officer and her family. And we are going to have a memorial service on the 15th of this month. I believe that's next Friday, to honor her and to take care of her. If you're struggling with the loss of our soldier, there's many places who you can turn to. Please do not internalize your concern. You can reach out to our chaplains, to our MIFLICs, to the chain of command, and we'll get you the help and services you need. But please reach out and share, because a lot of folks were impacted by the loss of this great soldier. Sergeant Major, do you have any comments?
Yes, sir. So, as a family, we are all devastated by this senseless, horrendous act. And as professionals, as soldiers, part of our creed is to never quit. And in this case, we will never quit seeking justice for Drill Sergeant Mitchell and her family, and for our entire Army family. I realize that this is an impact at the human level, and the effects of this loss is going to reverberate throughout our command for the foreseeable future. And it is normal to have feelings across the spectrum as we individually process through this loss of our teammate. And as the CG said, reach out. If you're struggling, there's many different people who can assist. And I strongly encourage leaders at all levels to check on their people. And if you come across anyone, and when I say leaders, it doesn't matter what rank or position you're in. Leaders are every single person in this organization. So if you come across someone who is taking this loss, taking the loss of our trainee from November, or any other losses, more in depth than what would be expected, or maybe impacting their performance, to reach out to the chain of command, reach out to the chaplain, reach out to behavioral health, seek other avenues for finding some sort of relief from this grief and stress. Throughout the entire time that this particular incident was occurring, I want to commend the leaders at the brigade, the battalion, and the company level who acted extremely professionally, who stepped up, did everything appropriately, and responded extremely well despite the very horrendous nature of what the organization was experiencing. So, as I stated earlier, check on your people, and leadership are checking on their people, but leaders are not immune to the stresses associated with this. So I just ask everyone, if someone is checking in on you, check in on them. Take that time to see how they're doing, because oftentimes those that are the checkers are sometimes lost in being checked on. So everyone has to practice self-care as we move through this time frame. And you know, some of the other unsung heroes that have stepped up in this time of need, and many others, are our command chaplains. And I personally want to recognize the chaplaincy team that has been there throughout this crisis and have also readily responded to our request for spending more time checking on others at what may be considered the inopportune times throughout our formation, through evenings, through weekends, and through those times that wouldn't be traditional times to check in, because we know that grief and working through this is not constrained by the clock. So my personal thanks to all of the chaplains and our command chaplain, Chaplain Van Dress, for really spearheading that focus on everyone. So chaplains seem to be everywhere throughout our formation doing great things. So we will get through this with the assistance of others. Nobody is alone through this, and please don't try to get through it alone. Thanks, sir.
We're a team, right?
Always.
And we've got great folks out there, total confidence in our company command teams, battalion command teams, the brigade command team. So very, very proud of our drill sergeants, very, very proud of our instructors, and then, like the sergeant major said, our chaplains, gee whiz, talk about combat multipliers. They're everywhere at once, and we're eternally grateful to all the work that everybody's doing, not only with this challenge, but all the other challenges that we may encounter as well. So we've had a busy week here at the national level. On Wednesday, the Capitol was stormed. A lot of emotion. I urge us all to remember to maintain our military bearing. Remember our behavior, especially in the social media space, and who we interact with and how we interact. Remember that we are soldiers, DOD, civilians. We're all on the same team, and we are professionals. On the 4th of January, Joint Base San Antonio went from HPCOM Bravo Plus to HPCOM Charlie to better help reduce the potential spread for COVID-19. As we know, in Texas and in San Antonio, I think the positivity rate was around 23% as of a couple days ago. I don't know what it is today, but General Miller, our commanding general of JBSA, is making all these proactive measures to minimize traffic going on and off base so that we protect our force. So what does this mean? What does Charlie mean versus Bravo Plus? Well, I'll run through a couple items here. So child development centers and youth-centered school-age care programs remain open to mission essential and critical personnel. However, there will be no open recreation or youth sports activities. The fitness centers, aquatic centers / pools will remain open to active duty, guard, reserve, and DOD civilian and mission essential and critical personnel only. A big thank you to General Miller and the JBSA team, because both myself and Command Sergeant Major Charpentier look at these assets, our gyms and our pools, as critical behavior health assets for the health of our teammates. So what does it mean? What does this mean if you've been on a telework status here for the last year? Yeah, last year, 11 months, 10 months, March or so. Continue to march. No big change to how we're doing managing the workforce. With the new guidance, no more than 50% of personnel should be in the office under Charlie. And keep that in mind. And if you don't feel safe coming to work, stay at home. Remember to share with your supervisor what you're planning to do. If you've been teleworking and you don't want to come in, okay, go ahead and continue your telework means of working. If you're tired of being at home and you want some social interaction with your colleagues at work, then come to work. The key thing is that we can't have more than 50% of the staff in an office, and I ask supervisors to manage all of that. One thing I forgot to mention here is that on the 9th, the JBSA will enforce 100% DOD ID card check, uniform service ID check on all occupants 17 or older entering the installation. So please, do not forget your ID card, because that'll cause some friction for you as you're trying to get on base. Sergeant Major?
Yeah, and really, as we look at this shifting from Bravo Plus to Charlie, it's really something that we were projecting and looking at as being necessary as we come out of the holiday season, knowing that the local area case rates are going up, and making sure that we're doing everything we can to protect the force as we try to reestablish our bubble for our trainees. So I know it's been a couple weeks since we talked about this, but really refocusing back on wearing the mask, washing the hands, and watching the distance. Those things are vital to protecting ourselves, protecting others. So just encourage everyone to remain vigilant, remain focused on those things, because the more we can get this under control now, then the sooner that we can start looking at potentially transitioning back to HPCon Bravo Plus, and ultimately in the long run, which is what everybody's looking for, although we don't know when, transitioning back to some state of normalcy.
Yep, Sergeant Major. All right, so holiday block leave reintegration. Over 3,000 students have come back. They went out for 2 weeks. They got to see loved ones, friends, and the soldiers that I've talked to have shared, haven't talked to everybody, but a number of them have shared that they had a pretty good time. And that is great. And I know that our own permanent party staff, our drill sergeants, our instructors, our cadre has had a chance to kind of recharge as well over the holidays, and that's really, really important. Number one priority with holiday block leave is to reestablish the safety bubble. All the soldiers came back in. They were screened. We had a number were COVID positive, a very small number. In fact, I was pleasantly surprised at how low that number was. And we're doing with them what we have done with all our COVID positive soldiers, is they've been taken to Lackland, where they get a recover there for about 14 days, and then we bring them back into the trainee population. Our command surgeon, Dr. Nadia Pearson, fantastic surgeon, again doing great things. You see her everywhere at once. Thank you, Nadia, for all that you're doing. But she has done a number of things to make sure that we are taking care of folks. The screening process, when soldiers came back, they are immediately screened and taken care of, and we identified where they need to go. And then she's also got a number of antigen testing kits. The antigen test is something where you know the results roughly within about 15 minutes or so. This is surveillance. And what I mean by that, this gives us a feel for the prevalence of COVID-19 in our formation. Is it spreading? Is it the same? Or is it decreasing? It's not as sensitive or as specific as the PCR test, which BAMC's doing. And thank you, BAMC, by the way, but is another means by which we can ascertain the amount of disease, the virus, I should say, which is in our formation. And so we started doing that the antigen test, and we'll continue to do that. Like I said, 15 minutes and we know our results. And it's just another tool in our kit bag that we're using to help manage COVID-19. Like I said, soldiers come back, 14-day ROM process. Want to shout out to the G6 community, our IT community. We got Wi-Fi up and running. They are doing virtual learning. Talk to the brigade commander out. We want to get the soldiers out for PT a couple times a day so they can interact, catch up with each other. Definitely they're going back to the DFACs. And with that instruction, which can occur outside, we give them that opportunity as well. 14 days, we're almost a week done with the first tranche, and then next week, and then we'll be ready to hit it as we were. And I'll be very confident then that the safety bubble will be reestablished, and we'll be dealing with the onesies and twosies, which we have been before holiday block leave. So,
Hey, sir.
yeah, sorry, man.
I just want to add in, because this was something that we talked about a lot previously, and you mentioned the small number of folks that did come back COVID positive. How many of them are going to get in trouble, sir?
Zero.
Thank you, sir, for reiterating that. We understand that life happens and things happen, and that even those individuals that are taking every single precaution to protect themselves and protect others, this virus does not discriminate, and sometimes it does sneak through the cracks. So just wanted to reiterate that nobody's going to get in trouble. And as we led up to this holiday block leave period, a lot of the discussions that we had and really focusing on the faith, trust, and confidence and the professionalism, not only on our cadres part, but also on each and every soldier that was in training and their families, that they were going to do the right thing so that way they could get out and enjoy the holidays. So I personally want to say thank you for following through and not letting us down with that belief and trust and the confidence in your abilities to get through this. I'm extremely happy that many of you got the opportunity to go home, to see friends, to see family, to spend time during the holidays and really reconnect and kind of recoup and recharge and get ready for the next year of challenges. And maybe there'll be some different challenges, but we're continuing to work past the ones that we have now. So one thing that I know that neither you or I have to remind our leaders to do is to stay engaged, because we've seen the engagement already. We continually see the engagement, but leadership presence is incredibly important as we continue through this short ROM period, because I know that those individuals that are almost halfway through that restriction, they're looking forward to the opportunity to get back to the normalcy of the Army life and the Army training environment. So just keep it up, stay smart, stay strong, continue to focus on what you can do for your own physical and mental resilience throughout the ROM period. Stay as active as you possibly can, because a healthy body will in turn result in contribute to a healthy mind.
I'm very proud of the discipline of our soldiers.
Could not be more proud of what they accomplished.
Yeah, we have a discipline. So Mom and Dad, thank you so much for your support, and you can be proud of your soldier as well. And we owe you. We owe you. Hey, so our mission continues, and we've had a couple things that may have knocked us off stride here at the beginning of 2021, but we are focused on the mission. 3,000 folks came back from holiday block leave. We got 34 courses in session, and the subset of that is 73 classes. So in the last 41 weeks, just to give you an idea, scope, we've graduated over 17,000 graduates from over 700 courses. That is a lot of soldiers, and that all goes towards readiness and making sure that our hospitals have trained staff, and our forces command formations also have medics in their formations to take care of them as well. Very proud of the entire team, and we will begin resuming shipping of soldiers to first unit of assignment here in the ensuing days, and we have yet to ship a single sick soldier. And I thank the entire chain of command for their discipline and how we've executed that mission. But I tell you what, Tish, me and the Sergeant Major have been talking a lot, and I'm sure there's some questions out there. out
Yes.
there.
Yes, sir. We'll start with some COVID-related questions.
Okay.
For you, sir, the vaccine. When can MEDCoE soldiers, civilians, or retirees get the COVID-19 vaccine?
Right. So, great question, and ecstatic that that question's out there because that shows that there's interest in getting the vaccine, and then there's trust in all the systems and institutions which produce the vaccine and are distributing it to us. So the FDA, Food and Drug Administration, approved an EUA, Emergency Use Authorization, which has allowed for preliminary distribution of the vaccine. All right, then once it goes to FDA approved, then it'll become probably like a flu shot, right, that we get. It's FDA approved. A number of phases. We are right now kind of in phase 1A, stepping into 1B, and it goes through each tier of the population that will get the vaccine here in DOD. And I think that I heard that there may be kind of a relook at the DOD phasing. I could be incorrect, so don't take that to the bank. But right now, what you need to know is phase 1 is that all of our providers, everybody involved with healthcare delivery who've been on the front line of this disease, our nurses, our respiratory techs, our physicians, everybody, they're the ones that are getting immunized first, vaccinated first. And the San Antonio military community, Wilford Hall, Brooke Army Medical Center, right now they're working on immunizing some of their folks right now. The initial shipment is going towards immunizing their staffs right now. To show that, to demonstrate that I have confidence in the vaccine and leadership has confidence in the vaccine. I got my first shot a couple days ago, earlier this week, and I got my second shot here in around 20 days or so. I will tell you that I did not even feel the needle go into my arm, other than kind of a little bit of Charlie horse type feeling in the muscle. No sickness, no kind of like flu-like symptoms that you get sometimes after the flu shot. It was really pretty much a non-event to me. As soon as we get the schedule for the MEDCoE staff, for our trainee populations, for our civilians, our family members, and all that, as soon as we know that, we are going to share that, and we are going to begin vaccinating Ricky Tick. And it's going to probably come like a tidal wave. All of a sudden, this is conjecture here, we're going to get a lot of vaccine, and we need everybody to come here and get the vaccination. And so we are putting together a plan right now to get the teams together and how we are going to actually administer the vaccine here to the Medical Center of Excellence staff. So we will keep you informed along the way and with as much lead time as possible, so you know when to come get it. You'll know. Now, encourage everyone to get the shot. When I get my second shot, I'll let you know how it goes for that one. But I think it's going to be pretty much like my first one. Sergeant Major, any thoughts on that?
Yeah, actually, the main thought there, I was kind of thinking, because you said you didn't even feel the needle go in, it's probably because it was one of our expertly trained medics that actually went through our schoolhouse and had one of our great instructors teach them how to properly administer a vaccine without even having everyone feel it.
Yeah.
So, it's just great that the vaccine is starting to be available, and look forward to getting to a point where we do get past the emergency use authorization and get broader opportunities for everyone across the force.
Thank you so much. So, Major, next question for you, actually. And so, when available, are soldiers going to be forced to take the COVID vaccine?
The interesting question that's surfacing. So, short answer, no. There is not going to be a forced injection as long as we're under the emergency use authorization. So, it's highly encouraged, and it's something that as we, a professional force, look at the benefits and the possibilities of goodness that are going to come out of this, then of course, encouraging everyone, particularly as we're the centerpiece for training for Army medicine, having faith in the vaccine, having confidence, and then also preparing ourselves and protecting ourselves as potentially being at higher risk, being exposed to it more often in a healthcare setting. So, of course, there will not be any forced requirement for anyone, any soldiers at this time. So, as far as those individuals that are familiar with some of our tracking systems, the MEDCoE or MEDPRO system, basically it's a dashboard, a computerized dashboard that tracks everything that we have medically, from our teeth to our periodic health assessments, to include all of our vaccinations. So the entry, it will be one of three things: either taken, not taken, or does not wish to take. So it's already programmed into the computer and is an opportunity. So much like getting the COVID virus, if an individual opts out of taking the vaccine, there is no negative repercussion. They're not going to be punished for not taking the vaccine. So
Did you say no negative repercussions?
no negative repercussions. Okay. So, you know, our thought process and really relying on the professionalism and each individual's realization of the goodness that can come out of this is that everyone will be inspired to receive the vaccine. And that ranges everyone in our Army family. In our Army family, just to define it for maybe some of those who are new to viewing with us, our Army family are our soldiers, our civilians, our families, our retirees, and all those people who are supporting our mission set here. So, you know, if you have concern about getting the vaccine, then I suggest that you talk to your healthcare provider, do research from reputable organizations, from reputable sources, and so that way your concerns can be allayed, and you can work through and make a good, informed decision for yourself as you move forward. But remember, the more people that get both doses of the vaccine, the better off we're all going to be, because it's going to potentially limit the spread of the virus in the long term. So just like we've been looking at the phases of fighting against COVID and really changing and adjusting throughout this process, just remember there will be phases of vaccine distribution. So we, through these town halls, are dedicated to providing you the latest updated information, so that way you know when it is available in your area or in our area here at Joint Base San Antonio. So just look forward to everyone being COVID-free. That's the goal.
And we're going to hit that goal.
Yes, we will.
Okay. Sir, this next one is for you, and it's a two-parter. The first is, how many soldiers tested positive after holiday block leave, if you're allowed to tell us that? And the second part, the person was asking, they might not have heard your comments in the beginning, if we tested soldiers upon their return from holiday block leave. That's a live question.
Yeah, okay. So I can't share the number of soldiers that tested positive when they came back from holiday block leave, but what I can share is that I was pleasantly surprised at how low the number was. And like I said, that goes back to the soldier discipline, to mom and dad at home respecting that discipline, and very, very impressed. So what happens when the soldiers came back is that they were screened. And if they were symptomatic, or if they were symptomatic, they were tested, and if they tested positive or symptomatic, they went into our ROM facilities over at Lackland Air Force Base, which are there for about 10 to 14 days until they get through the course of the virus. So we had a pretty good feel as to our population within about a day and a half of those who were either had COVID positive, who were COVID positive, or were showing some symptoms. Remember, we're in the middle of flu season, and also we're in the middle of CEDAR right now. And so a lot of things to trigger cough, sneezing, all of that, and which could present or make someone think they have COVID when they don't. The only way to know is to test, but we had a great team that worked tirelessly to go ahead and screen every single soldier. We're well on the way to establishing the safety bubble, and we'll have that locked down in about another 6 days or so, and then we'll be back to training how we were.
Thank you so much. Sergeant Major, this one is for you, staying on the question of testing, but why was my soldier selected for antigen testing? And first, Sergeant Major, what is antigen testing?
Wow, what a great question. And while I'm not a physician and we don't have the command surgeon here this week, I'm going to do my best to answer this as correctly and appropriately as possible. And so some of this I probably will be looking at a few notes just to make sure I'm getting the right information to you. But so earlier this week, our command surgeon began validation of antigen testing at our point of care testing site here at the Medical Center of Excellence. So, and we refer to it short as the COVID Surveillance Center, or the CSC, because every Army name has to have an acronym associated with it. And we have one here at the Medical Center of Excellence at Joint Base San Antonio as far as the Fort Sam part of it, and then we also have one over at Lackland for our population that lives and trains at that location. So the purpose of the testing is for surveillance, and it's really to provide an additional means to maintain health and welfare of our staff and students, to make sure that we continue our training mission and conserve the fighting strength. So thinking of it in the aspect of those that have been in the military as having a test for a urinalysis, and it's not necessarily a suspected situation. It's just one that's random checks, and it's a spot check to make sure that people are free of, in this case, the COVID virus. So if your soldier was selected for testing, it's more than likely a completely random check and sample, and not because they were exhibiting any type of signs or symptoms or considered high risk. It was just luck of the draw. So if they were selected for that antigen test, then maybe that's the day that they need to buy a lottery ticket, because maybe their luck is really good that day. So although it's not as sensitive or as specific as the PCR swabs that you might get at a hospital or at your local pharmacy, the antigen test is a very quick, easy, and provides results in about 15 minutes. So it's a way to screen very quickly and get results very quickly. So soldiers that do not have symptoms, asymptomatic soldiers and staff, will be scheduled for screening purposes. But just remember, any soldiers who have symptoms will continue to be tested with the standard PCR screening test at clinics and the hospital. So really, if you have the opportunity to get this test, it's not an indication that we think that you're sick or that you have an increased risk for it, but it's just another check to help you to have the peace of mind to know that, hey, I'm doing well and I'm not a carrier. So we believe that this is a very low risk operation as we rotate our student population through this testing venue, and it's going to facilitate us getting back into establishing that bubble a little bit more quickly and more effectively. So it's going to benefit the health of our personnel. And one of the stories that I hear and that we hear across the medical community is that some people are genuinely shocked when their tests come back positive, because they're not feeling any illness, and they just happen to get tested, not in this operation, but just historically over the past 9 to 10 months. Some of the people that have tested positive really were shocked to find out that they were positive. So we're just incorporating this as another proactive measure to help protect our soldiers, our population, and our mission. So just remember, if you have symptoms, whether or not you're in this population or not, that's for the random screening, let somebody know. Distance yourself. If you have symptoms and you're on the staff and you don't have to physically come in, call your supervisor, let them know, hey, I'm having symptoms, and then move forward to take care of yourself, get in contact with your healthcare provider, because ultimately, like we said, we want to eliminate the COVID infections.
Yep.
Thank you.
And you can't get in trouble if you let your drill sergeant know if you have
No, and I will applaud just all of the individuals that, even while on holiday block leave at home station, actually reached out back to their drill sergeants, back to their leadership to let them know, hey, I'm at home, I'm not feeling well, I got a test, and I'm waiting for the results. So great job.
The Army made a great decision sending its soldiers on holiday block leave because the Army knew that its force was disciplined and that it trusted its soldiers. And troops, very proud of you.
Thank you so much. Sir, this is a live question. I think it's based off of your comments earlier about the situation in D.C.
Mm-hmm.
Please address the rules, regulations, policies that cover civilian employees who continue to voice their opinions at work that the election was stolen. And we will refer them to some exact regulations. But, sir, what's your opinion on that?
So, the Hatch Act prohibits us from talking about politics in the workplace if you're a government employee. And that's law. And we are a nation of laws. We follow the rule of law. That's what we're expected to do. And so that I ask that all of our teammates, whether you're civilian, whether you're uniformed, we respect the law and do that. You can have whatever opinion you want. That's okay. But we're not supposed to discuss these things. And quite frankly, let's just be civil with each other. We know that what happened in Washington, D.C. in the election is a very polarizing series of events. People have strong opinions about those either way. So let's not antagonize each other. If I'm sitting in a room with some other people who feel 180 degrees opposite other than me and we're on the same team trying to work towards a certain end, why would I say something that would anger them or create just a lot of friction and animosity in the workplace? The old saying my mom taught me, if you don't have anything nice to say, don't say it. And I think this applies to the situation here. There's lots of data and there's lots of information out there on the validity of the national vote at the state level on whether it's valid or not. Do your research. Good research, and I think you will come to the conclusion as to whether this election was thrown or not. But I would ask, this comes down to dignity and respect and being sensitive to those that you work with. And if they don't want to hear about it, if they have a different view, let's not kick the dog while the dog's sleeping. Let's just focus on the mission and what we have to do during the day. Thanks. I know we'll do the right thing on this.
And sir, just to follow up on that, to our Army family, and like I said earlier, that's military and civilians alike. For those that are serving in those instructor positions, please remember why you are here and why you're part of the Army family. It's to teach, coach, mentor, and train this next generation of Army leaders and healthcare professionals to be able to save lives. So please don't waste any of their time or your time on discussing things that are really potentially divisive, and focus on those things that are going to help save a life and help that young medic to be able to be successful on the battlefield. Thanks again for what you do.
Okay, thank you so much. And this will be one of the final questions before we turn it over to closing remarks.
Okay.
This is from one of our drill sergeants. When do you anticipate a change to the mask rules?
Well, I'll jump on that one,
Okay.
sir. Change to the mask rule. So I would say, as long as COVID is out there and running rampant, that masks will be worn. They need to be worn. It's what's protecting our organization. It's what's protecting our team. So as we work through this, until we get to a point that COVID is not an issue, a thing that is pervasive throughout our cities, throughout our military, then I don't see a whole lot of, and depending on where you're going with this word of change to the mask rule, I'm making an assumption that it's a question, are we going to relax the mask rule? I would think that no, it won't be anytime soon until we see some very scientific data to show that we can do that, sir.
Yeah, so you look at the flu epidemic in 1918, I think they were struggling with that to around 1922 or so before they finally moved past that. We could make a similar a similar comparison here. So, you know, I hate to conject on time or how long it'll be, but you know, it's conceivable it could be up for another year. Could be shorter, could be longer. I don't know. But here's what we do know is that this thing really does work. Now, is it inconvenient? Yes. Do we now have masks like our glasses, you know, stashed in the car, in our purses, all over by our bed, everywhere, so that we don't forget? Yes, we do. And so, but I can't overstate, you know, the big three and their effectiveness. The mask, the hand washing, hand sanitizing, and social distancing work. And I just got to use myself and my own behavior and why I'm a believer. I've flown 3 times in the last several months. I've been out on the town to shop at HEB. I've gone to a couple gun shows. In all of those events, I've had my mask on and I've had very, very, very liberal use of hand sanitizer after a transaction or looking at a piece of merchandise or something. And knock on wood, you know, if I got the disease or the virus, I'm not having any symptoms, but I don't think I have it. And all my 2 tests have come back negative. So what I ask teammates is that we continue to believe in this thing because the science is there. This thing really does work. And if we just look at our own organizational discipline, the fact that I see everybody wearing these things, and the fact our numbers, when we stack up our numbers on COVID positive cases against the other centers of excellence, we are very, very low. And that's because of you. Drill Sergeant, appreciate the question, and I appreciate what you and your drill sergeant peers do. Thank you so much.
Yeah, definitely, sir. And you know, I just want to echo the trust and confidence in the mask, because one other thing that you didn't mention was the number of times that we went out and actually had close contact with some of our trainees and staff members who were COVID positive, and we were masked during those interactions, and so far we have been able to come back with negative tests and have not suffered from that disease. So you know, I too am a true believer in this, and you know, as we move forward and as the vaccine becomes more prevalent, just because you get the vaccine doesn't necessarily mean that you need to stop wearing your mask also. So just something else to consider and think about to protect you and to protect others. So Drill Sergeant, great question, and thanks for asking a question that probably everybody else on the net wanted to ask but was afraid to.
Yeah, and you bring a good point, Sergeant Major, that I wanna reemphasize, is that let's not become complacent once we get more and more folks vaccinated. COVID-19 is still going to be out there, so it's going to be a while before we can come off these. But okay, Tish, what else do we have?
Sir, I think that would be your closing remarks, and
Okay.
reminding that we're not going to have one next week because of the training holiday. So.
Oh, that's right. Okay, all right. Sergeant Major?
Hey, sir, thanks. So, you know, having the opportunity to get back and join with each one of the MEDCoE family members virtually is really a pleasure for me to be able to find my way onto your computer screen, your phone, or wherever it is. And thinking about everything that has transpired, occurred, and some of the things that we talked about, you know, I just want to reiterate that anyone that is having personal difficulties with the loss of Drill Sergeant Mitchell or any other service member or family member, speak up, reach out for help. You're not alone. You know, it's something that you don't have to go through this by yourself. You know, whether it's a good friend, whether it's a instructor, supervisor, chaplain, behavioral health provider, myself, the CG, talk to somebody. Talk to somebody, because we just don't want the grief to consume you. And knowing that, talking about before the holiday season, that, you know, not everyone has fond emotions associated with the holidays. Well, that still extends into the post-holiday season time. So I would just encourage you to reach out. So thinking about Drill Sergeant Mitchell in particular, knowing that we have the memorial and the opportunity to really focus on her professionalism, the goodness, and the contributions that she's made to the Army and to the nation. through our memories and through the memorial itself, I know that the memorial is going to be a hard time. It's going to be difficult. They're never easy. But it is a step, and it's an opportunity to move towards healing. Not towards forgetting, but towards healing. So, our sincere hope, desire, drive is that, law enforcement is going to find the perpetrator of this heinous act, and justice is going to be implemented to the fullest measure, because this is one of my squad members. This is one of my team members, one of my family. And, I'm angered, saddened, frustrated over this loss, and I just want justice to occur, as many of you also want. So I would just encourage, as we move past this, think about the opportunities that we have had for goodness. Take a moment and tell someone why they are important to you. Give a hug to someone. Thank someone for their contributions. And while I can't actually give a hug to all of you out there virtually, I will say thank you. Thank you to every soldier, every civilian that works here in the Medical Center of Excellence. Thank you to every family member that supports those soldiers and those trainees that are coming through our center, and to all of the retiree population and everyone else that plays a part in making sure that our Army remains strong. I appreciate your sacrifices, and I appreciate what you do every day. Thanks, sir.
Yep, thank you, Sergeant Major. Hey, one more administrative note for our teammates that live on Fort Sam Houston. So Lieutenant General Richardson, the R North Commanding General, who is also the Army Senior Mission Commander here on Fort Sam, is very concerned about the quality of housing, the quality of work, support we're getting from Lincoln Military Housing, and wants to hear from you. So what she has asked, and we're going to do in support of this, is there a chain of command visits to everybody's house on post, if they permit that. That's a key thing. If you don't have to allow someone to come visit your house. And we're not there to go, it's not like a health and welfare check where we're going to be running through your drawers and all that. It's to get a sense, are you satisfied with the responsiveness of work orders? Do you have any mold, plumbing, electricity issues? Is there anything that we can share back up through to Lincoln Military Housing to let them know this is where they got to improve? And we're going to kind of track by each house all the defects we're seeing or the concerns of the occupants, so that we share that up there. This is all in an effort to better serve you and to make sure that you're living in good homes in a healthy set of quarters that you're able to flourish and thrive in. So we're supposed to have that done by the 28th of February. More details to follow. We'll do a very robust information campaign on that, so that you know what's going on and no one's caught surprise. Again, if you don't want anybody to visit your house, or you just would rather have a talk, on the front door stoop and not anybody in, fine, that's okay. It's your call, but we're here. This is here to better serve you. And if you recall, we went through this Army-wide about 2 years ago, 2.5 years ago. Very thorough analysis, because there were a lot of concerns, highlighted of which I just mentioned.
Hey, sir, just one thing with that.
Yep.
It's your opportunity. If you've had that lingering work order that's been out there that hasn't been addressed, hasn't been fixed, or hasn't been fixed to your satisfaction, and you're feeling like you're not getting results or support, that is your opportunity to have a clear line of communication to myself and the commanding general. That way we can engage General Richardson and Senior Mission Command staff to facilitate getting that corrected.
Yep. Okay, teammates, 2021 did not start out how I had hoped, but I remain convinced that our best days are ahead of us. And I sincerely believe that. Dignity and respect.